Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan. Now, here is your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is outpatient therapy. And with me in the studio is Laura Leitz, outpatient manager for HealthSouth Sea Pines Rehabilitation Hospital. Welcome, Laura.
Thank you.
It's a real pleasure to be able to talk to you at this point in our development of a show on stroke rehabilitation, what you can do, how rehabilitation helps people, and just getting information out to the general public. I think that people are misinformed and certainly undereducated about the value of physical, occupational, and speech therapy in your overall care process. And you admitted to working here for 20 years before the show started.
Yes.
But I'm certain, Laura, you've seen so many things, people trying to cope with the problems of recovery from hip surgery, stroke.
Knee surgery, head injuries, spinal cord injuries, everything. And I think the hardest thing is to continue to cope with it after the therapy, but also just being involved in the therapy, knowing, what your choices are, what your options are, sticking with it. That's probably one of the hardest things, is to really keep that motivation and to stick with it in the long run.
Yep. A word that keeps coming into the conversation is motivation.
That's probably one of the most difficult things, but it's probably one of the most important things. You can come to therapy. We may see a patient 2 days a week or 3 days a week, and one of the first things I will tell them is that if you don't work at home, if you don't follow through at home, you will not get the results that you need or that you want. Because seeing me for 45 minutes to an hour, 2 or 3 times a week, is not going to be enough to make the changes that you could make if you also practice it daily at home. And that's true of anything that you do. In order to be successful, you have to practice.
Okay, now you're talking from a therapist viewpoint. Let me talk from the patient viewpoint. After I went through my stroke and I recovered at Woodstock, they sent me here to HealthSouth Rehab Center, Rehabilitation Hospital. And I remember my first session in rehab. It was not easy.
No.
It really wasn't. It was hard. And when I went home and I had physical therapy, I knew that I had to do those exercises on a day that the therapist didn't come. But it was not easy.
No.
And at times my wife would say, Joe, you didn't do your exercises today. I said, yes, I know.
No, it's not easy. And I tell patients that you have to make it, commit to it as if it's your job. Just like you go to work every day when you went to work, or you eat breakfast every day, you take your medication every day. All of those things are things that you have to do whether you want to do them or not. So it becomes a part of your day. It's a commitment that you make. That's just like a job. Things that we tell patients are, put it on your calendar. Do it the same time every day so that it becomes a part of your schedule. Write it on your calendar. It becomes a commitment. And I've never had a patient come to me and say, I did my exercises and I really wish I hadn't.
I wish you hadn't.
They've never told me, they've never regretted following through with them. When they do follow through, when they do their exercises, they see the benefits, they see the success. That's motivation to keep doing it.
Another thing that was brought home to me last week, just a week ago, by my in-home therapist, I wasn't feeling well. Mm-hmm. And one of the risk factors for strokes is atrial fibrillation. I've suffered from atrial fibrillation for 25 years, and I know that. And I knew that for a couple of days I did not feel right, but the therapist came to the house, and as soon as she took my blood pressure and I described to her how I was feeling, she called the nurse to make sure the nurse came over to see me too, and she said, we're not going to do therapy today. Your body is telling you not to do this. And this is one of the things I think in having, whether you go to a rehabilitation hospital or you go to a rehab center or you do outpatient therapy or in-home therapy, the therapist that is assigned to you, I think is extremely important if you have the same therapist.
I agree. I agree. And we try very hard in outpatient to do that, to have consistency so that you have the same person, they get to know you, and then they can also, you have that consistency each time. Especially in outpatient where your time is limited. That way, each time you come, we try to progress a little more and progress a little more. So you're not doing the same thing every time you come. It's not a maintenance type of thing. You know, our goal is to keep making progress each and every time you come. And in knowing you, if you come in one day and you're not feeling right, or your blood pressure's wrong, or your heart rate's not right, you know, we know the doctor. We're going to call the doctor. We're going to report that, and we're going to take the steps, whatever it is, whether it's sending you to the doctor, whether it's sending you to the emergency room, whether it's just saying, you know what, we shouldn't do therapy today, you need to go home and rest, whatever the case may be, we're going to make those recommendations as well.
I found that the home nurse, well, the nurses I had here, I had the same set of nurses. So they watched what my actions and reactions were to different medications, and I could ask them questions and I could get a good answer. If they didn't know the answer, one of your doctors would come in and talk to me. The same thing followed up with Gentiva Home Healthcare. Is I've used them several times before, and I knew about them before I even knew about HealthSouth Supines. And the nurse that is assigned to me actually was a doctor in a foreign country, but he's not credentialed to be a doctor here. But I have found by having the same therapist and the same nurse come, they're able to observe my change or lack of change. And if I have a question about something, I feel very comfortable in asking them. And I've asked them, as well as I ask your therapist here, to tell me if they didn't think I was doing the right thing. I wanted them to tell me.
Correct.
I realized that a lot of the effort had to come from me.
It does.
Yeah.
It does. You know, our goal is to educate you. Our goal is to, you know, put you through exercises and balance training or whatever's necessary to help you reach the next level, whatever your goal is. But again, we have to educate you so that you know what to do when you go home. You know, when you go home, we want you to be able to know the correct exercises to do, how to do them, how many times, when to do them, and to feel comfortable with knowing when an exercise is too much for you, or how to progress the exercise from one level to the next. All of those things are things that we're going to want to teach you, your family, everyone, so that especially once you're finished outpatient, you can carry on.
Okay. Let's say that somebody 82 years old is watching this show, and they're having trouble with their balance, and they haven't addressed that with their doctor. Maybe they've been able to shield that from the doctor. Probably the doctor's picked up on it, but say the doctor hasn't picked up on it, and the person's watching us talk about outpatient therapy today. That person can talk to their primary care doctor and say, I have a problem, doctor, with my balance. Do you think that you could prescribe outpatient therapy for me?
And that is one thing that we see patients, especially elderly patients, for frequently, is they're falling or they're having more difficulty walking because they're losing their balance more. They'll come to us. There are certain tests that we will do to check their balance, which will tell us how much of a fall risk they are. And then we can use those tests to show progress. We teach them exercises that they can do to help improve their balance. Sometimes their balance is impaired because of strength deficits, so we'll work on making them stronger. We'll work on balance training. We can use all different types of tools to help them learn to balance better, to compensate better, teaching them about safety in their home, making sure that they don't have throw rugs that they're going to trip over, or those types of things. It may be that they need to use a cane for a period of time until they're safer, or it may be that they just need to learn certain compensations to make sure that they're safe. But those are all things that therapy can work on. And I've seen many patients for that, all of whom normally have benefited from the therapy to the point where then they aren't falling or they aren't having as many of those balance issues. And then they can go out and do the activities that they want to do again and continue to keep the exercises up so they don't lose what they've gained.
But if a person is eligible for Medicare, all these services can be prescribed by the doctor and paid for by Medicare.
Yes, as long as there is a reason for them, whether it's because they're falling, whether they're having difficulty walking. Those are all things that Medicare will cover therapy for, as long as therapy can show an improvement.
Right, yeah.
So if for some reason they came to therapy and we saw them for 2 weeks and there was no change, then we might not keep them very long. It might just be educating them on exercises to do at home. But as long as therapy is showing improvement, then we can keep them in therapy for a period of time in order to help them be more independent and to be safer.
With all the changes in medicine and the delivery of medical care, especially with the Affordable Health Care Act and with medical managed care, privatized care, I think it's going to become, that outpatient therapy, rehabilitation therapy, and therapy directed to the activities of daily living for seniors is going to become more prominent and more prescribed. And I think as people are more informed and better educated about what can be done to help people prevent falls and move safely, I think they will be able to drive down the cost of care.
Well, and again, the more we can keep people safe, keep them from falling,
Yes.
educate them, rehabilitate them so that they are safer, the less likely they are to end up breaking a hip, ending up in the hospital, which costs lots of money, ending up in a nursing home or assisted living facility sooner because they can't take care of themselves, so they can stay at home longer if we can keep them safe and independent.
Yep. When I was going through the occupational therapy here when I was recovering from my stroke, the therapist was demonstrating to a group of us safety in the kitchen. And she took the container from the microwave, sat it down in front of the microwave, shut the microwave door, stepped over, took the dish and moved it to another sink, then stepped over another counter, stepped over to that, moved it to another one, instead of taking the container from the microwave and trying to turn around and walk with it.
Right.
It's little simple things like that if they're not pointed out to us, we don't see the true importance of that as a safety factor.
Yeah, and sometimes it's just little things like that. If you've been sitting down for a long time and you go to stand up, stand still for a minute before you start walking. Make sure you feel steady. Make sure you're not dizzy. How to get up. How to get up out of a chair that's low to the ground. There are certain things you can do to make that easier. And those are all things that we teach as part of when we see a patient, little tricks like that. How to get up out of bed and make it easier. All of those things just to make it so they are successful, but it's also as little energy as possible.
If you could help me or teach me how to get up out of that chair without hurting me, I sure wish you would.
Well, there's a lot of little tricks in how to get up out of a chair, that people don't realize they did automatically before, but now they have to think about it.
Yes, but the therapist does this to me. She says, put your arms across your chest, and I want you to get up out of the chair without using your arms.
Exactly. And that is one of the things we do to test for balance is can you get
I
up
know,
without your hands?
I know. But, you know, the difference, like I couldn't get up out of my kitchen chair from the position she had me in, but she put a 4 or 3-inch rubber pad underneath me, and just by leaning forward a little bit and at elevation, let me leverage myself up without using my arm.
Right.
This is what you teach people in outpatient therapy as well as your regular inpatient therapy classes here.
Correct. You know, we'll teach them the technique to use to get up so that they can do it. We'll try different levels. Maybe we start higher and work our way down.
Okay. Let's say a person comes to HealthSouth for the start of their rehab after a stroke, and they're here 2 weeks. Mm-hmm. How do you make a decision that a person can go from facility rehab to maybe in-home therapy, or would you go to outpatient therapy? What is, I'm not sure anymore, I don't understand. I've been to outpatient therapy without being in a rehab hospital. I've done in-home therapy, but I'm trying to figure out, sometimes your therapy can be completed in-home without going to outpatient.
And it depends on the goals and how much progress the patient makes. After they finish inpatient rehab, the decision is made whether they go home and they have therapy at home or they come to outpatient. Outpatient requires more energy expenditure in the sense that you have to leave home, you have to get to outpatient, and then you have to participate in outpatient, and then you have to go back home. For some people, that's just too much. You know, by the time they get to outpatient, they're exhausted and they don't have the energy to do the exercises.
I can
In
understand.
that case, having home health for a few weeks, building up their energy, getting them stronger, then coming to outpatient works better. Sometimes if it's an issue of they just can't get to outpatient, they're just not able to leave their house yet, whether it's because they need too much physical assistance to do it, or they don't, again, they don't have the energy to do it, or, they live alone and there's just no way for them to get out. All of those reasons can also be reasons why they may need to have home health therapy first, and then as they get stronger and they get back to being able to get out of the house with less assistance, get out of the house with less fatigue, get back to driving, whatever the reason, then they can progress to the next level, which would be outpatient therapy. Now, there are instances where they may not go have home therapy. Sometimes you've had a hip replacement, you've had a knee replacement, you're able to get out and you come to outpatient therapy straight from inpatient or straight from the hospital. And you start outpatient right away so that, they're more ready to work on more aggressive exercises or more aggressive therapy so that they can not need the home health therapy in that respect. So it just depends on the individual patient, their level, and what their tolerance is.
I don't know if it's a mental or a physical thing, but I found in my own case that once I left the hospital here and I got home and I started moving around home and getting outside and using my cane instead of my rollator, that I felt my sense of independence returning a little stronger, and that caused me to try harder to do the things that I was doing before the stroke. Does that make sense?
Yes, and like I said, nobody likes being in the hospital.
Yes.
So once you get home, you tend to do more because you're in your home and you feel more comfortable there, you feel safe there. So you tend to, want to do more for yourself, want to get back to doing the things that you were doing before, all of which are things that we're going to work on. So one of the first questions we ask you when you come to outpatient therapy is, what's your goal? What do you want to be able to do so that we can have a plan for, okay, this is how we're going to work to get to that goal? Or it may be, well, that goal may not be realistic. We may need to work on a lesser goal and then see if we can get to that goal.
Okay, so one of the things I hear you saying that viewers should be paying attention to is that to set milestones that for accomplishment, and then once you reach certain milestones, then the therapist should be able to direct you to the next set of wickets to go through.
Correct. And we do that. We set short-term goals where we'll work on, maybe you're on a walker now, and our goal is to get you to be able to get to a cane. So instead of going from a walker to nothing, there may be intermediate steps between there and nothing. So we may go from the walker to you working on using a quad cane or using a regular cane. And then as you get better with that, then we can look at, okay, are we going to be able to go to the next level, or are we going to need to wait until you get a little stronger? All of those things. So we set short-term goals, which we look at along the way, and then we set long-term goals, which are our end goals. We want to get to this point, by the time we discharge.
Yeah, and as a therapist, I'm sure that you can appreciate that as a person gets older, you have other illnesses that sort of, let's say that you've had a stroke, and as you walk the stroke recovery path, you've got little things called arthritis, fibromyalgia, years, and you take all those side effects and you put them on top of the effects of that stroke, and you look at all this medication that you take, and you try to figure out how. Well, I say that the patient should be talking to the doctor and the therapist about what they are doing, because I think if you had a patient tell you that they think they're over-medicated,
my first recommendation would be that they make a list of all their medications, that they go to their primary doctor, and that they sit down with him and they tell them that.
Well, that's what I did here. When I left HealthSouth, I think I had 18 medications, and the nurse, realizing that I'd never remember when I was supposed to take all those full things, she put down a time for every one of those things.
Right.
Of course, I was no longer in a hospital, and I wasn't going to start taking medications at 2 a.m. at home and end at 10 p.m. at night and take those things all day long.
Right.
So the biggest challenge my wife and I faced were figuring out how to put those medications in a group. And once we did that, then we checked with your people here, and we checked with our doctors to make sure that we had them in the right group. And we did.
Right.
And of course, my problem was compounded by the virtue of the fact that I have an aneurysm as a result of my dissection of my aorta. So they had me on Coumadin, and I had all these medicines. So you have to be aware of so much. And that's why it's so important for patients to tell their doctors every blessed medication they take, whether they're prescribed or over the counter.
Exactly, because vitamins and supplements can affect the medications that you take. So it's very important that they know everything that you take. One of the other things that we tell our patients if they're going to the doctor is make a list of your questions. Write down all the questions that you have and take the list with you, because 9 times out of 10, you're going to get there and you're going to leave and you're going to say, oh, I forgot to ask him this, or I forgot to talk about this. So if you go in with a list, then you've got that list, and then you know that you're not going to forget anything. If you feel like you're not going to remember what he tells you, take someone with you so that you have another set of ears hearing what you hear who can help you remember, oh yeah, he said this or he said that.
And make sure that that set of ears doesn't wear hearing aids. So I take
So
my
you
wife.
both can hear.
My wife tells me what I didn't hear.
There you go.
Quickly tell our viewing audience the types of therapies that are conducted in outpatient therapy. What all can you do?
We do physical therapy, occupational therapy, and speech therapy. So as a general rule, physical therapy is going to work more on your mobility, your ability to walk, your ability to get in and out of bed, your balance standing, your balance sitting, as well as your strength in your trunk and your legs and those types of things. And then occupational therapy is going to focus more on your activities of daily living, being able to take a shower, being able to get dressed, being able to feed yourself, your upper extremity motion and strength, as well as your coordination. Maybe it's being able to write. If your writing's impaired, giving you different tools or different techniques used to improve your handwriting after something has happened. Your coordination, being able to pick up little things or or, use fine motor tasks in your hands so that you can regain that function. They will also work on your some cognitive aspects in the sense of like vision and perception, your eye-hand coordination, being able to coordinate, what your eyes are doing with what your body's doing so that the messages are getting from where you want them to go and producing the action you want them to produce. And then,
It's like when your therapist had me putting the pieces of pipe together.
right, being able to know which piece goes with where. 'Cause you have to look at how they're shaped and which piece goes with where and doing those types of things. And then speech therapy can work on a multitude of things. Maybe it's that your swallowing is impaired and they're going to work on their swallowing. They have different tools and machines that can help with that. Your speech, maybe you're not understanding speech, or maybe you're not able to speak because of the stroke. They're going to work on improving that and techniques and compensations for you for that. They may also work on your cognition, your memory, your ability to perform daily functions, whether that's being able to manage your finances or being able to use a calendar so that you can remember appointments. All of those types of things are things that speech therapy will coordinate. And even in an outpatient basis, if you're getting all three, or even if you're only getting two, we all talk to each other daily. So OT may have you doing things standing up to work on your balance to carry over with what PT's doing for your balance. Speech may say, they're not understanding messages, you need to give them in, simple commands, or you may need to do, so we all communicate with each other so that you get that carry through from one therapy to the next therapy to the next therapy, because the more you repeat it, the more ingrained it becomes in you, and the more of a chance you have of reproducing it once you leave.
My sense after going through the speech, occupational, and physical therapy here at HealthSouth Sea Pines was that the associated areas covered in speech therapy are probably the least understood. Mm-hmm. The swallowing problem. That was, while I didn't have a speech problem, I later learned that I did have a swallowing problem. And
that's common after a stroke.
Yes. A lot of things are common, but it's important that the patient try to identify to the therapist the things that they don't think are common.
Yes, it's important for you to communicate with us what you're having difficulty in.
And I want to thank you, viewer, for watching today's episode of Focus on Seniors. If you have a question or a comment, please call us at 321-473-7770. We can give you more information on senior care and resources. You can also visit our website at helpingseniorsofbrevard.com. And I want you to focus on our show, Focus on Seniors, on radio station WMEL 1300 AM every Thursday morning at 9 a.m. And look for us in Florida Today newspaper each Thursday in our health section. I'm Joe Steckler, and thank you for joining us today for Focus on Seniors.